Post-surgical complications can arise as a result of a lot of different things, which is why it is extremely important that you are very thorough in your post-op instructions to your patients and making sure that they have a clear understanding of what they should and should not be doing, how long they should leave the gauze placed in their mouth, what they need to do as far as diet goes after an extraction. And that's something that you might need to go over not only with the patient if they're been under IV sedation, then obviously you're going over post-op instructions with the caregiver who is going to be helping that individual. But some of the complications that can arise post-surgery is going to be something called alveolitis, or alveolar osteitis, which is also known as dry socket. You may have heard about it, or you may have experienced it yourself if maybe you had some wisdom teeth extracted or a tooth extracted. From what I have heard, I personally have never experienced a dry socket, thankfully, but it is very painful. It usually occurs 2 to 3 days post-surgery. So that's usually an indication if a patient calls in and is saying that they have pain. That's the first thing you're going to want to look at is when were they seen for their to get that tooth extracted, because that's going to kind of give us a better idea as far as if it could be a dry socket or not. And alveolitis or dry socket is basically that. It's when the blood clot has been lost and the socket is basically open. The clot actually protects the exposed bone, which prevents it from getting an infection. Once that clot is lost, and the clot can be lost due to a variety of different reasons, want to make sure that you read about those, what can occur, what can cause a patient to lose a blood clot in your book. Make sure you look that over, because it's important for you to know what can occur. Sometimes it's just something that happens. It can or may not be caused by something the patient did or didn't do. So some of the symptoms that the patient may experience is definitely pain, pain that radiates up until the ear area, maybe along the neck area, depending on which tooth was extracted. Dry sockets typically happened on mandibular teeth. However, we have, in very rare cases, I have seen a dry socket occur on the maxillary. Usually the patient indicates bad breath or bad taste in the mouth, and on some occasions it could result in some swelling as well. Usually what will happen is once the patient comes in and we kind of get a sense for when they were seen, we'll bring them in, we'll verify that it is a dry socket, and usually that's something the assistant can do is actually pack the dry socket. So usually there's a lot of different things that can be used. What we used to use is this iodophor packing strip. We would dip it into the dry socket paste. It's a very different type of odor that is emitted. I oftentimes, if I packed a dry socket, I would smell that all day long. It's a very unique and not a fun smelling. I couldn't imagine having that in my mouth. But usually within either putting it in, you're actually inserting it in with a cotton plier very gently, because the patient's going to be in pain, and they're going to be sent home, and usually within an hour or so they start to have some relief from the pain and discomfort. So usually with the dry socket pack is we would have the patient come in every day for 2 to 3 days, and we would remove the pack and we would put a fresh one in. And then once we would kind of evaluate them at about the 3rd or 4th day, depending on the severity of the dry socket, and we would determine if we felt that it was going to be okay. And because the thing with that is if we continue to disturb that area, it's going to take a lot longer for it to heal. So we want to make sure that we get the infection cleared up as soon as possible to allow that socket to start to heal. Other complications that it can occur is bruising, any kind of edema or swelling, infection, which again could be related to a dry socket, and of course some pain. So important to go over and be very thorough in your post-op instructions to the patients or their caregiver.